Thank you for coming to the last communication seminar of the semester, sponsored by the PRC and the MCHLT. And today we're very happy to have our own Naomi King, who's the communication and training coordinator, and she's going to talk about effective messaging in public health.
Hi, thanks everybody for being here. As Shokafe said, I'm Naomi King. I work at the Prevention Research Center here at Tulane. Before we start, a lot of this talk is based on a report that came out in 2010 from RWJF, the Robert Wood Johnson Foundation. So at the end, I'll provide a link to that report if you do want to read the whole thing. I really enjoyed it, so I did read the whole thing. I thought it was a great foundation. They did a lot of research on different messages. And then, of course, I'll also talk about my own personal experiences in messaging and being a professional communicator. So, turn this on. So a little bit about me. Like I said, I work at the Prevention Research Center. I do communications, electronic, new media, and traditional publications. I also coordinate our training programs. We also offer practicum opportunities every semester for you students who are looking for practicum opportunities. These are some pictures I've taken of work that we've been involved with. One is Sankofa Farmers Market on the right, and the left is International Walk to School Day. So it's fun stuff. My background is I worked for 5 years as a government reporter for the Courier, which is in Houma, not far from here. It was a New York Times regional newspaper group. It's since been bought by Halifax. And I've also been an intern and freelancer for other publications. And these are pictures of either me interviewing a trucker or pictures I've taken while out in the field. The guy on the left was a shrimper who said that he thought that his breathing problems and his wife's breathing problems were the result of the FEMA trailers and the formaldehyde that I'm sure everyone remembers hearing about when we had tons of FEMA trailers everywhere. And on the right is Mike Carlos. He works for the state and is a coastal restoration guy. He's talking about Raccoon Island, which is Barrier Island. So I've interviewed people from science, public officials, down to shrimpers and truckers. So you got to communicate with a very broad spectrum when you're a reporter. So today's agenda, we're going to talk about what is social determinants of health, why we need a better way of communicating the social determinants of health, word choice, and effectively using data to support your case, as well as we're going to do a little bit of practice. So keep in mind that today's discussion is all in the context of communicating with the general public and policymakers. Also keep in mind that newspapers typically write for an 8th grade reading level. This is true. So just keep that in mind whenever you're doing any sort of messaging for the general public. Also keep in mind that everything is relative to the population you're trying to target. For instance, research shows that different messages on posters promoting stairway use are effective for different populations. Those who are not active versus those who are already active. I was reading a report that said for people who are not active, promotion of stairway use, when the messages talk about losing weight, that's when they're more likely to take the stairs. Versus someone who's already taking the stairs, you may want to talk about the health benefits and encourage them to continue doing the behavior that they are. So, social determinants of health. You tell me, what is it? You guys are the public health people. Anybody? Yeah.
Factors like maybe perhaps dealing with or there are factors that are socially constructed, so like gender, class, education levels, things like that are not like really biological.
Okay, awesome. So that's a little bit more of a public health definition, and what's great about our WJF's report is that they put that into language that is easily accessible to people and the general public can understand. So they say health starts where we live, learn, work, and play. Now, you guys may have seen this phrase in different messages. It's been in scientific journals it's been used in. So this is catching on, and I think it really is an effective way to talk about it, just from my own experience of when I talk to policymakers or just people who don't know the work that I do, explaining it, it's much easier with a phrase like that than the social and physical environmental factors, you know. So, these are examples of the social determinants of health. This guy's using the stairway in City Hall. Jewel is taking measurements at a grocery store, and these are the Kids Rethink, you know, showing how health starts where we learn too in schools. So some other versions of the phrasing that RWJF found were effective was your opportunity for health starts long before you need medical care. And these are all variations of pretty much the same thing. You know, health starts long before illness in our homes, schools, and jobs. All Americans should have the opportunity to make the choices that allow them to live a long, healthy life, regardless of their income, education, or ethnic background. So the reason why these work is that these statements use colloquial, values-driven language and relatable lifestyle references that engage audiences. They also all focus on the solution versus the problem. I know in scientific journals, a lot of times the introduction starts off with facts about the obesity epidemic, for example, or you know, those data-driven things. And I think to a regular person, when you read that, it's starting off with the problem, and that can turn off a lot of the general public. Of course, we're not talking about scientific publications now. And also, some of the statements implicitly acknowledge the notion of personal responsibility. And we'll talk more about why that's important later, because it's key to avoiding political overtones. So why we need a better way to talk about public health, and especially social determinants of health. This was a quote that came out of the report that I thought was really interesting. There's no silver bullet, no single word or fact that will suddenly transform how people think about health. It is an intensely personal issue that carries with it complex beliefs, conflicted values, and a deeply divided electorate about what leads to better health. To explain, so why we need to do this is we need to explain why some Americans are much healthier than others and why Americans overall aren't as healthy as they could be. Essentially, we need to explain why there are disparities, right? We also need a better way of talking about public health because the language is very foreign to most people, but the concept is often obvious. Again, when I've talked with people in the public about the work that we do in particular, if I start talking about social environmental factors and determinants, eyes glaze over, they don't know what I'm talking about. But when I do explain that parks need to be safe so that kids can use them, I get lots of head nodding. So we also need a better way to talk about public health so that policy funding and health messages are not caught in political gridlock. And as we've seen with healthcare reform, there's a lot of political overtones when it comes to that particular issue. Also talking about word choice, we're going to talk about avoiding the political overtones, avoiding jargon, and cutting clutter. So we're going to do a little bit of background and talk about the different views and why the two sides, I guess you could say, the dominant sides in American politics feel the way that they feel about health. So the Democratic view is focused on system deep metaphor. Individuals' health impacts the whole nation. Flaws in the system contribute to poor health, and one change will not fix the system. The American society is a complex system founded on rights, one of which, or should be, the right to health. So this is based on some interviews that are within this report, and it's really interesting to see the quotes too from the Democrats who were interviewed. The Democratic view also follows a container frame. Containers keep things in and keep other things out. They protect us or they trap us. And these containers are social, physical, and psychological. an issue here is barriers when it comes to the containers, and Democrats feel that there's inherent barriers to certain people being able to access things that are not in their neighborhoods if they don't have transportation or education. How are they going to be able to get out of that container is where that belief comes from. There's also, within the Democratic view, a balanced deep metaphor. And this is where the ideals of social justice and equality come in, because there's an imbalance between the haves and the have-nots. Balance is desired for access, treatment, and outcome. And this is key because Republicans also have a sense of balance, but they understand it in a very different way. And I think that's really interesting. So this was a collage that a Democrat created, and it's included in the RWJF report. And it shows the container metaphor that literally this child is isolated. They're covered, they're contained, and they're separate from this other part of society that has lots of opportunities and resources. And these are some of the quotes that came out of their interviews. Another point that the RWJF report talked about is that Democrats are angry about what they see as an imbalance. I thought that was really interesting too. Another collage that I couldn't get the picture for had a woman screaming, like she was so angry about the situation. So that's another thing to keep in mind when you're thinking about the different perspectives. The Republican view follows a journey metaphor. This is so Republicans are typically fundamentally more optimistic about where we are today in terms of the health of American population and its long journey. So a typical statement may be, well, look at where we are today versus 100 years ago. We've come so far. There's that kind of statement that's reiterated in that circle. And there's truth in that. There is truth in that. It's just different than the Democrat view. For individuals' journey too, Republicans see that poor health arises from bad choices along one's path and the inability to overcome obstacles to health. Poor health is couched as a failure to give people a roadmap of how to achieve health. So again, about the journey, it's about people taking responsibility for their own actions. And personal responsibility is definitely part of going back to that message of the different versions of how to talk about social determinants of health. There's an inherent idea that personal responsibility is part of the equation. So acknowledging personal responsibility, but then also those things that we talked about before, your environment, your neighborhood, those things that you aren't genetically predisposed to. So another view or another metaphor of the Republican view is this resource metaphor. This view says that resources such as money, food, and natural resources are finite. So a comment would be, for example, we need to be realistic that every person cannot have everything. This is where the ideal of most bang for the buck comes from. And this is, again, there's truth in all of these statements. It's just a matter of perspective. And I thought this was an interesting part of the report. It says where Democrats tend to see resources going into a system where they circulate through different communities and programs without necessarily being exhausted, Republicans see a zero-sum game. If you pour all of your resources into low-income communities, there is less for the rest of America, and you simultaneously have not guaranteed that you actually help that community because you did not necessarily pinpoint the most strategic uses of those funds and services. So, as a reporter, I've heard a lot of public officials use the phrase, get the most bang for your buck. And so that's where that perspective is coming from, and I think it's important to recognize that and not dismiss it when you're working in public health, because again, there's some truth to that. We don't have money to give to every single program there is out there. Another metaphor that is part of the Republican view is the balance metaphor. Again, going back to the Democrat view, they both see balance or have values of balance, but they're different. In this case, Republicans see equality as more of a scale where you have to take things away from the people who are well off in order to give them to the poor. So they feel that it is natural that there will be differences in individuals' health. So the solution is a balance between what is provided by the government and what is expected of the individual. So again, the idea that not everybody can have the same resources is where this is coming from. And so one quote from a Republican was saying, well, Democrats would be just as happy to bring the top down as they would to bring the bottom up, but we want to bring the bottom up without having to bring the top down. So I thought that was interesting, because it's not that one side is right or wrong, just again, different perspectives. So this is a collage by a Republican, and you can see the road is the journey. People have choices that they can make. I'm not really sure what the bull is. Anyways, taking the bull by the horns, there you go, thank you. So, I mean, this again is something that you'll hear a lot in public health and from policymakers, is that individuals have to be able to make the right choices. There's only so much you can do to give people access. So, what to avoid? Through their research and looking at these different perspectives and testing different messaging, they learned that people with more conservative views tend to have negative reactions to the goal of equal levels of health for everyone. So they suggest that you avoid any variation of the word equal, equality, or equalizing. Don't say leveling the playing field. Again, that goes back to, well, you can't level a playing field. There's just, not everyone can have the same level of health. Creating balance. They also suggest that you avoid unjust or injustice, outrage, immoral, or unconscionable. I think also, they didn't say this, but I think also the word social justice should be avoided. I went to Loyola, and that was like one of the 3 phrases that I remember was on the table when I signed up to get information with social justice. But I think now that's being turned into socialism, and it's being, you know, a lot of words are being used in different ways now compared to social justice, and the Jesuit institution is, you know, that's a very old, traditional, and I think pretty conservative organization. But anyways, again, I would suggest avoiding social justice as well. So in also talking about word choice, I think we should also talk about avoiding jargon, because you'd be surprised what people don't understand, you know, the average person. Again, talking about going back to writing or messaging at an 8th grade level. This is what we're talking about. And again, as a newspaper reporter in the past, I had to break myself of writing in jargon, because dealing with government officials, they talk to you in jargon. So here are some examples of jargon that have really come up before. I believe that the average person will not know what the phrase health outcomes means. I don't think that they'll even know what intervention means. Infrastructure. My boss at the paper hated that word. She would say what it is. Is it a drainage ditch, or is it a road, or is it a sidewalk? The word zoning. A much easier phrase is land use regulation, or land use rules, or rules that say what can be built on pieces of property, such as commercial, residential, or industrial. Give specific examples. Stakeholder is another one that I come across more now, and I just don't think an average person is going to know what does that mean. So this was a phrase that came up recently while I was going through some editing with a coworker. If you need to put it in a glossary, just leave it out. If you need to have a glossary, just don't and leave it out. And so again, use specifics in place of the jargon. So again, instead of saying infrastructure, say specifically, or if you want to say infrastructure, put a comma and say like sidewalks and roads. So in the discussion of messaging, I think it's also important to talk about, cutting out clutter and just really making messages concise and taking out superfluous words is really, really important because people's attention spans are quick and you need to get your message across. So again, this is an example of something I've edited and are helping to edit. So this is how the sentence is or the paragraph or sentence part is starting. Many partnerships already exist. Sorry, bad spelling error there. However, this is how it's currently worded. We must continue to strive to strengthen these existing relationships to use a comprehensive approach in addressing fitness and obesity challenges. And this is part of a report about fitness and obesity challenges. So to me, well, I'm going to ask you guys, how could this phrase, the A part, be shortened? Yeah?
I have a question. Who's your audience here?
General public. General public.
Remove strive.
Yeah?
We
Because-
must work together
Yeah?
to fix these challenges.
Yeah. Yeah. And yeah, because I think, again, one of my former bosses would ask me, well, why you strive to strengthen? Well, aren't you just strengthen it? If you're trying, you're not doing, so just do it. So
Give her the whole first.
yeah.
We must continue to strive to strengthen these existing relationships. It should just be existing partnerships should use a comprehensive approach, blah, 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 and then that's it.
Yeah, I mean, of course, there's no totally right or wrong answer. I just shorten it to we must strengthen these relationships, because it's all within a report or context of this plan to try and address fitness and obesity challenges. I just don't think you even need this last phrasing. So, in messaging, it's important that we effectively use data. I, again, thought this quote from the report was really telling. As communicators, we can't do our work without making use of the facts that are the foundation of our work. They establish the prevalence of an issue, communicate its effect in both economic and human terms, and communicate responsibly about the effectiveness of an approach or intervention. Funders and policymakers place increasing value on sound evaluation and research to guide their investments and decision making. So, I mean, the work that we're doing as public health students or practitioners and the data that comes out of that is very, very important, and policymakers look to that to make their decisions. And I think probably most people in this room do want to make an impact on the policy level and see the value of that. So, however, there are some ways to use data to its fullest. Less is always more is the first point that our WJF report makes, and I would agree. People can feel overloaded, and if you're talking about statistics in Louisiana, you can get down pretty fast, right? Because even after like 2 or 3 statistics, it's like, oh man, oh, that stinks, But less is always more is also important. They suggest, and I would agree, like if you're doing a short messaging, like a paragraph or 2 paragraphs, keep it down to like 1 or 2 really facts. I think is important, because one great fact people will be able to more easily remember it. The second point that they highlight in how to effectively use data and messaging is to use complementary, not competing data. So advance, don't repeat your narrative. Again, I've seen this in public health writing, is like, again, when you start spouting off the statistics of Louisiana health, it's just like, oh man, you know, one after another, and it's like, it's just repeating kind of the bad statistics, and it's not necessarily advancing what you're trying to say. So an example that that they gave in the report is in Little Rock, Arkansas, middle school last month, over 108 suspensions resulted from fights during recess, a time when kids should be playing, recharging their batteries, and return to class ready to learn. After a new program called Playworks was introduced into the school, suspensions dropped to 0. Again, they used 2 pieces of data. One helped advance the other, and in fact, it complemented the other. One laid out the case, the other one highlighted the solution. The third point that they make is context is king. So how and where a fact is placed is crucial, especially if it challenges an existing belief. And they give an example that we'll talk about later about, for example, if it challenges an existing belief, to put it up front, people are going to be like, well, I don't believe that, and they're less likely to believe what follows. So again, placement is crucial. If it's a fact that maybe challenges an existing belief, set it up first with something that they can believe in. Like for example, in Louisiana, people nod their heads when you tell them a statistic about some of our health indicators. They're like, okay, yeah, I figured, you know. And then so stating that and then following up with the more challenging fact, they'll be more likely to believe it. Also, specific examples matter. Again, when you're, let's say, setting up that message about a challenging fact regarding Louisiana health, when you first give that example of a health indicator in Louisiana, making it specific to like a neighborhood gives people an idea. They're like, okay, well, I can believe that. That neighborhood, yeah, that makes sense. They have good health because, you know, they're upper income or whatever. And we'll talk about that too a little later. Also, don't let numbers be forgettable. So round out numbers and don't overcomplicate the statistics that you give. So they give the example of like, why say 23.6% of those who live in poverty didn't graduate high school when you can say almost 25%. Obviously, for a scientific journal, you want to be specific, but round out the numbers and saying things like 1 in 3 instead of the percentage. It's that way people can remember that fact a lot easier. Another point that they give, or suggestion that they give, is breaking down big numbers. So instead of saying health insurance costs $1 trillion over 10 years, health insurance costs $3 a day for every American. Breaking it down in a way that people can understand. I mean, $1 trillion is like an insane amount of money, and people literally cannot wrap their brains around it. Like, again, I have been in many conversations with my former editor about $1 trillion and $1 billion and what that really means. Another example I would give was that whenever I was talking about volume or I would report on the oil field industry in Houma, and there were a lot of waste facilities there, and they would process water that would come up through the ground and then discharge it. And there was one particular facility that wanted to collect a lot of this discharged water and treat it and then put it into the Houma Navigation Canal, which was near the drinking water source. Anyways, to try and explain to people how much water would be coming out of this facility, treated water, every month, it was like 80,000 gallons a month. break that down for people. I broke it down into Olympic-sized swimming pools. And I think that people can better understand what that looks like. And then also the value in a number is in its values. Let me get a little more specific because that might be confusing. Numbers can represent both a value and our values. You can say that half of all parents in poor neighborhoods don't feel safe letting their children play on the streets. Or you can say, or you can try and create a picture of what it must be like to feel trapped in your own home, unable to move because of your job or income, not able to give your kids the most basic opportunities to play outside or run free, but instead fear that they could get caught up with the wrong crowd. So that is painting a picture. A lot of what we want to do as public health practitioners is paint pictures for people to give faces to the data. As a reporter, again, that was like how I presented most of my stories, was starting off with the woman whose home flooded because of a bad drainage situation, and then I would write the story about this new drainage project happening in her neighborhood. Giving that face to it, people were more likely to continue reading. So also when you're using data, imagine why someone might cry foul. And that goes back to, again, when you're dealing with the a fact or data that you come across or that you found that may challenge existing beliefs, take into account that someone may not believe that. And what RWJF found was that a lot of people didn't believe that the life expectancy in America was not in the top 25 in the country. So that they had to be careful how they worded that and where it was placed within the messaging, because people didn't believe it. They're like, no way. Also, just again, overall messaging rules still apply, is what RWJF says. Facts are part of the message, not separate. So take into account everything, and I think that follows a lot of the placement of your fact and where it is, and make sure that it builds and advances your narrative. So we're going to do a little practice. So read this, we'll read it together, and think about what makes this message work. America leads the world in medical research and medical care, and for all we spend on health care, we should be the healthiest people on earth. Yet on some of the most important indicators, like how long we live, we're not even in the top 25, behind countries like Bosnia and Jordan. It's time for America to lead again on health, and that means taking 3 steps. The first is to ensure that everyone can afford to see a doctor when they're sick. The second is to build preventative care, like screening for cancer and heart disease, into every healthcare plan and make it available to people who otherwise won't or can't go in for it, in malls and other public places where it's easy to stop for a test. The third is to stop thinking of health. Sorry, I have some typos in here, guys. The third is to stop thinking of health as something we get at the doctor's office, but instead as something that starts in our families, in our schools and workplaces, in our playgrounds and parks, and in the air we breathe and the water we drink. The more you see the problem of health this way, the more opportunities you have to improve it. Scientists have found that the conditions in which we live and work have an enormous impact on our health, long before we ever see a doctor. It's time we expand the way we think about health to include how to keep it, not just how to get it back. So again, this message was developed, tested, revised again, and they found that it was effective across all political backgrounds. So can anybody tell me why you think this was effective? Just some of the good things about it, I guess you could say. Yeah.
It laid out the solution in 3 easy steps.
Yeah.
Started with a positive, something that we can all believe, instead of turning our ears off.
Yeah, I mean, that goes back to what I was saying before about we're not even in the top 25 of life expectancy. They found that people just straight up didn't believe that. So they knew that they had start with something that people could believe. Yeah, of course, we're America. We're this superpower. Of course, we lead the world in medical research and medical care. Yeah. Anybody else? Yeah.
Well, and that way you've got, you said the Republicans like to know the journey behind us and how far we've come, but then you've also got going forward and how that affects us to both.
Yeah. Anybody else? Yeah.
It gives specific, so it defines what preventive care is, giving very specific examples of what would qualify.
Yeah.
And they're all things that we're familiar with. Like we all know cancer and heart disease.
And we all know what screening for that means. It means you go to the doctor and they do some sort of test on you. You may not know exactly what it is, but yeah, while it uses a little bit of jargon, in my opinion, it gives an example that it's like, oh, okay, thanks for explaining that. And so here's the reasons. Some of y'all already said them. Starting off with something most believe, they're more likely to believe what follows. Words like insured and uninsured are hot buttons. Again, this is going back to some of the debate going on right now with healthcare. So instead saying ensure that everyone can afford to see a doctor.
Change the letter.
Yeah, I mean, I think this is what they say is the alternative. I think even ensure that everyone can afford to see a doctor could still be a little bit of a hot
It
button.
sounds almost like we want everybody to have the money to do it. So to me, that still seemed a little iffy.
Yeah.
And really it's about are doctors affordable rather than do we all have the money to
Mhm.
But I
Also
could see
mean
how
though,
someone
like,
could.
something like make sure that it's cheaper to see a doctor.
Right,
Yeah.
but I could see that some people would look at that and be like, well, of course everyone can't afford it because we can't distribute the wealth.
Yeah. And like you said, it includes specific solutions. It lays them out very clearly. It illustrates examples like parks and playgrounds. It also uses a broad phrase of scientists have found instead of scientists at the Centers for Disease Control and universities across the country have shown. So it's shorter, more colloquial, and relatable. And it's stripped of academic support, which I know, again, in scientific writing, you need all the academic support you can get. So it's a very different way of thinking when you're communicating with the general public. It can even turn them off, that something is when you start talking about universities and academia. The message is also framed in the context of accepted beliefs like the importance of access to care or prevention. This helps the message fit into a broader perspective of what it takes to be healthy. And it talks about, it also, there's inherent in there too the personal responsibility that someone, that they won't or can't go in for checkups, but if we put it in a mall or other public place, they'll be more likely to. But it's still up to them to go in and do this for themselves. So, I think I'm actually done. Sorry, we kind of breezed through that, but if you guys have any questions about this report, the report itself, there's also background on it and a webinar recording from when it was first released with their own slides, which are very much more for a public health audience, talks about the methodology of how they developed the messaging, as well as psychological theories and everything that went into this report and this research that they did. It's really interesting, but I wanted to keep it a lot simpler for this talk. So yeah, if anyone has any questions. Anybody? Okay. Thanks, guys.
So please make sure you sign in, and we'll be sending slides out if we have your email address. And we would love your feedback. And if you have any suggestions for topics for the communication seminars for next semester, please just write them at the bottom of the evaluation form. And I think that was really useful, because I think when we're in an academic setting, we're always encouraged to write as complexly as possible and in a very, academic way. And it's sometimes hard to adjust to, okay, how do we talk if we're talking to everybody else? And one of the things that I thought of when you were talking about writing to an 8th grade level is that one of the very simple tools is that Word has a way for you to tell you, in case you don't know, what your grade level is of something you've written. And I think that that's a good thing to do, especially early on, if you're figuring out if what you've written is simple enough. So it's usually like with the word count tools. So thank you again.
Thanks.
And we'll see you guys next semester.
Yeah.